on what it would entail, what the priority groups were. But what we've seen over the last few days is a fair degree of hesitancy as far as the vaccine is concerned, which is going to be a cause of worry for the government, which would mean that the government would look at setting an example of fearlessness and lack of worry about the vaccine by showing some of its top leaders, some of its top ministers actually taking the jab. To answer these questions, I have Abantika, as I mentioned, again with me today. Do start sending in your questions for Government Matters. So Abantika, you've done a story today which you can log on to our website, ThePrint.in, and read that the government is looking at ethical messaging. Now, what is this ethical messaging?
So we actually saw a small sample. So ethical messaging is that you sort of appeal to the better senses of a person. So yesterday we saw a small sample when Dr. Vinod Paul, who's member health Niti Aayog, he said, please look at it as a duty towards society, a duty towards your family. We need to restart our health services, non-COVID health services to the levels where they were before the pandemic. This will COVID-proof our health system. So, this is, it's a kind of, the messaging is basically going to hinge on making COVID vaccination a sort of a duty, something that you owe to yourself, moral obligation, a duty to society, a duty to nation, and also on top of that, there is this angle thrown in of, if you do this, your family will be better protected. So why should you want to expose your family to unnecessary risks when you have the option of a vaccine that protects you from the disease, that protects you from mortality? So there are two aspects of this. One is whether or not it prevents the disease. It probably doesn't. What it does, it prevents mortality.
Right.
The outcome is going to be less severe and you'll probably shed less virus, so you'll probably spread the disease less.
So this is true for both the vaccines?
Yeah. So for most vaccines currently, we are talking about reducing mortality, reducing hospitalization.
Okay. Right. So Abantika, now, now that they're talking about ethical messaging, etc., is there some sort of plan to put forth, say, the Prime Minister or Home Minister or anybody else who's, a political big heavyweight to take the vaccine, so that, because we've seen that internationally?
Yeah. So from what I understand right now, there is no plan like that. So what the Health Ministry tells me is that why should they take it? Because we've already had Dr. Paul, Dr. Randeep Guleria of AIIMS, the director of AIIMS. They have already taken the shot and they have set an example. We are essentially talking to healthcare workers. Why do we need a Prime Minister or a Bollywood? Those are the exact words used. Why do we need the Prime Minister or a Bollywood celebrity to take the shot? Because they will take it. Our priority groups are very well defined. Healthcare workers, frontline workers, people aged above 50, and people with comorbidities who are aged less than that. So, I mean, technically, all of these people, all the politicians that we are talking about, they would qualify in the third lot.
Right, above 50.
That's right. And some of them would qualify probably even the below 50s, even the comorbidities. But their point is that we want to set the record straight, that we don't want the queue to be jumped, like the Prime Minister has said very clearly that we elected representatives don't come in the priority group, so please don't try to do it. So that is the stand that the Health Ministry is currently taking, that we have made examples out of some very senior people in the health system, doctors. They are from the same profession that we are trying to address. So we have made examples out of them. Currently, there don't seem to be any plans for the Prime Minister or any of his ministers take it. In fact, on the first day of vaccination, on 16th of January, when Dr. Harshvardhan, who's the health minister, was asked this question, he said, I'll wait my turn. When the turn for the 50+ age group comes, I will. And this despite the fact that he himself, but he's not a practicing doctor. Right. That's the difference. Right. So his risk perception is far lower than, say, Dr. Guleria, who sees patients regularly in a hospital setting. So that is where it stands. And right now the government stand is that these are priority groups that we have decided. If we start off by sort of changing that, then down the line there will be so many changes and there will be so many people, influential people jumping the queue, that essentially the very idea of targeting vulnerable groups and first COVID proofing those groups before you come to people whose risk perception is less, that very idea would be dismantled. That's the fear.
Okay. So let me, before I ask you a few other questions that I have, let me first squeeze in a few audience questions. Hitesh Nautiyal is the first one. What is the status of other vaccines that are still in trial stage? There's another one. And under what agreement is the government sending vaccines to other countries?
The other vaccines that we have, we have one indigenous vaccine, Zydus Cadila, that is just starting phase 3. Sputnik has just started phase 3. Pfizer has applied. There is no movement on the on Pfizer's application for emergency use authorization. Then there are some other vaccines which are further down the line, in the sense they have some time to come. They are in phases 1, 2 trials, clinical trials. And then there's Moderna, which has not applied yet. It's been used abroad, but they have not applied as yet. So that's the status currently. And what was the second?
The second question is, under what agreement is the government sending vaccines to other countries?
So these are actually, this is a commitment that the Prime Minister made, that neighbors first policy. So it's a sort of India's India is a pharma leader. So right. as like a global pharma leader, India looks at it as an obligation to give vaccines to neighboring countries, and this was actually a commitment the Prime Minister had made quite a while back.
Right.
So
and also vaccine diplomacy.
That's right, yeah. And also some of these vaccines, not the ones that have gone today, but some of the vaccines are also partnerships that companies have with companies in
right.
those countries. Then some of the vaccines at a later stage that are going to go out, especially from the Serum Institute of India, will be a part of, because Serum Institute is a part of the COVAX initiative that has funding from Bill Gates Foundation, Bill and Melinda Gates Foundation, Gavi, and all of these places to ensure vaccine supplies for low and middle income countries. So under that also, SII will be eventually sending out vaccines to LMICs across the world, as and when the domestic demand is met.
Right. Okay. So Archana Dubey, with no apparent risk of the UK virus strain and declining case figures and fatalities, can we say that the worst is behind us, and by the time the vaccine reaches us, the virus could organically end?
Actually, that's a very interesting question. Because the world over, vaccine hesitancy comes from a sense of people forgetting what the disease looks like. The more successful a vaccine, the more are its chances of hesitancy at the population level. For example, you take the measles vaccine in the US. It was so successful
right. that
people stopped. They just forgot what the disease looks like, what kind of morbidities it leaves behind. And that is exactly, and I think part of the reason why the vaccine hesitancy is happening in India is that we happen to have introduced the vaccine at a time when the disease graph is naturally coming down.
Right.
The fear is much less, and because you see every day, you see the numbers coming down. There is this question in everybody's mind: what if I delay it and I don't need the vaccine because it's over?
But can it be over? Can we say it's over conclusively?
No, because everywhere else there is a second wave.
Right.
Also, so that's not the only reason for vaccine hesitancy. Why people are deferring this decision to vaccinate or not, even healthcare workers, is also because there are many unanswered questions about the available data. For Covaxin, we don't even have efficacy data. So that is another very sticky territory. Even today, in Delhi, RML had written saying that we don't want Covaxin. Today, the Karnataka Resident Doctors Association has written to the Health Minister saying we don't want Covaxin. So there are a lot of misgivings about the vaccines. Then there is another school of thought which says that a live vaccine is definitely going to be it's definitely going to have more side effects than a dead one. So there are many different theories and many different layers in this vaccine hesitancy story. But the fact that the India graph is coming down right. is, I think, a very important contributor to this.
Right, but it doesn't mean that we can let our guards down. We still have to continue wearing masks.
Not really. Vaccine or not, masks and hand washing is a way of life.
Right. Okay. I'll take this question from this handle called Secular Pujari. Why can't our leaders take the vaccine and assure us about its safety when doctors and nurses are rejecting the vaccine? Is it okay to take it? So, I know the government is saying what is the need to jump the queue and we should be seen as being proper and doing it in the proper order. But then there's something to be said about leading by example, which is what a lot of other international leaders have done.
Yeah, correct. There is something like that, but I think at some level even the government's apprehensions are not unfounded, because we already, even when this is the position, we have 2 Trinamool Congress MLAs taking the vaccine, we have the Telangana Health Minister taking the vaccine, we have
jumping the queue and taking the vaccine.
Yeah. So, then the problem, once that happens, then you have MPs, MLAs, panchayat members, sarpanches, their families, MPs' families. It will just go on and on. So that ultimately your sanitation worker will probably not even get the vaccine when his risk perception is much higher.
Sure.
So while I understand this, and I think in fact, I think at some point of time we will have to do it. The way things are going, politicians will probably have to step up at some point of time, even if it is not right now. But then we will also need to figure out a way to control this other problem. Down below what happens, that's also, and also see, your vaccine supply is not endless.
Correct.
You cannot do the jumping the queue and also ensure that people in the queue get it, because your vaccine supply currently
it's limited.
Is limited. It will come in installments. You have to also ensure that people who get it now get the same vaccine 28 days later. They get the second dose, because you can't use a different vaccine for the second dose. So all of these considerations, I mean, there is one very powerful argument for the Prime Minister and ministers taking it, but there are some very tricky logistical issues which will need to be sorted before that kind of a decision is taken.
So can you name a few global leaders who've taken the vaccine and who've publicly shared the fact that they've taken the jab?
So US President-elect Joe Biden, his VP-elect Kamala Harris, Prime Minister Boris Johnson of UK, Queen Elizabeth, Prince Philip, Benjamin Netanyahu of Israel. Israel. I mean, there are many. King Salman of Saudi Arabia. He's I think 85 years old. So all of these people have taken it, and they have made it a point to sort of publicize those photos and say that I took it. Like here, Dr. Paul is doing. Yesterday he was like, I have taken the vaccine and I have 0 side effects, and I'm very proud that I've taken the Indian vaccine. But maybe his message is just not sort of powerful enough.
Right, not enough people would sort of listen to it. Okay, anyway, so there's Harneet Bakshi. It's not about leaders taking vaccines. That does not prove that they are safe, but sharing data and long-term testing results too. There is no test results for me to decide that it's safe. So that's a very fair point.
Absolutely. That's I think a very important reason why doctors are hesitant. In fact, I've had conversations with doctors who say, why don't you go and take it? If you go and take it, my purpose is served, because we're talking about herd immunity.
Right.
One of us gets vaccinated, it's better than nobody being vaccinated. Right. So that is another very real apprehension, that we don't have this, we don't have the efficacy data. Now, why that's a problem? See, it's not so much the safety, even if the safety has been proven in small groups, but the efficacy is a problem, because suppose you take the first dose now, and 1 month later the efficacy data shows that it's 40%. What do you do? That is, I think people are waiting for that data to come in. Also, I don't think the government stand that the Bharat Biotech vaccine, because its whole virus is more likely to act against the UK strain. I think even that has not cut much ice, but that's also partly because the UK strain numbers are still very limited. Right. It's still quite contained. So I think that's another reason why, and nobody is concerned so much about the variant as whether this will give me efficacy, whether this will protect me. And also I think there are some quite genuine concerns about safety, especially for the live virus. There are neurological symptoms. Then recently there are all these deaths.
Right.
Yeah.
May or may not be linked, but that does give rise to a lot of concern.
Right. No, also internationally there are, deaths being reported. So all of that taken together, there is people are choosing to opt for wait and watch. And somehow I get the feeling that once this opens up, once regular people, non-medicos start getting in the COVID, getting registration in the COVID, it is possible that the uptake will improve.
Right. Okay. So Devil Gamer is the user ID. Is it safe to open schools for kids? There are already states that have started opening schools.
Right. So, one can't say for sure whether it's safe. So kids get the disease less, but they can spread it. But then again, the numbers are going down. It'll be here in March. How long does this continue? Kids will have other issues now. So I know it's difficult to make kids understand concepts of social distancing, physical distancing, hand washing, masking. But masking, I think everybody has learned.
I think masking is easier, but social distancing and hand washing is
that's right, especially when you meet your friend after a year.
Right.
So but I think we'll have to sort of take a calibrated decision on that. And like now there's class 10 and class 12 is opening year. So those sorts of decisions will have to be taken, and will have to be, as we go along, we'll have to devise more and more ways to make them work.
Right. Okay. So very quickly, I'll take a couple of more questions. Pushkraj Behere, if the current low turnaround for vaccines continue, which is less number of people coming to take the vaccine, how much time will it take to actually vaccinate the whole country?
Nobody has so far spoken about vaccinating the whole country. Kids are out because kids are not, they have not been tested, and the vaccine has not been tried in kids at all. No trial has had kids except Bharat, which did a small little thing. Then again, pregnant women, lactating women are out, allergic reactions are out. There are lots of people who are out. But this is not my estimate. People like Dr. Guleria, Dr. Gagandeep Kang, who's one of the most respected vaccine scientists in the country, they have been saying that for the average Indian who is not comorbid, who is aged less than 50 years, it could be 2022 before he or she gets a shot.
Okay, so that was actually Naveen Sharma's question also, that when is it planned to roll out for the general public who are who are not in the priority list, but I think you've already taken that. VS has a question about whether the vaccines are being administered as a one-time dose. Abantika has already answered that 2 doses in a gap of 28 days. Why isn't the government, this is from Parag Doshi, why is the government not making the vaccination process more transparent in the way that a common man can understand whether it is safe or not? Okay, so now let's end with this, because this episode of Government Matters is about messaging, and as we talked about ethical messaging from the government's part. Somewhere down the line, even if the Prime Minister doesn't take it, or even if there is no big bang celebrity taking the vaccine, is there a way for the government to allay fears, to send out a message, and as this viewer is pointing out, talk to the people and say that this vaccine is safe and which is why it's safe?
Right. So, of course there is a way, and that way has to be about, even if it's not the Prime Minister, about senior health officials, people like Dr. Paul, Dr. Guleria, who are already coming on TV, talking more. But I think a very important thing also is, suddenly for the last 2 weeks, we are seeing, ever since the vaccine rollout planning started happening, and after the rollout yesterday, the COVID briefing has suddenly become sort of very limited. We'll take 3 questions, not more than 3 questions. That used to be the case at the peak of COVID.
Right.
And suddenly that rule is back. I think that doesn't serve anybody's purpose. Questions we would ask are also questions
normal people
are asking. These are, and some of these are queries that even we have. So if there is a reluctance on the part of the government to answer our queries with such artificial barriers, such as we will take 3 questions and not more than 3 questions, we will not talk about why we are sending it to neighboring countries, and these are all things that happened. So I think that kind of reticence does not serve anybody's purpose.
Right.
This is, the more information, the better.
Right.
No. So for example, these deaths that have happened, you've told us that they're not causally linked to the vaccination. Why not take more questions? Why not explain what happened? Maybe some of those questions are going to be silly, but in the end, if it serves your purpose, if it serves the purpose of convincing people, why not do it?
Absolutely.
You know, the more you come across as trying to hide, the more people think you have to hide, whether you have something to hide or not.
Right, absolutely. So Abantika making a very pertinent point about the importance of transparent, frequent and uninhibited messaging from the government on the vaccine, also giving us a well-rounded view of vaccine hesitancy and what the government should and can do to address that. Also this evening at 7 p.m. we have an Off the Cuff where our editor-in-chief Shekhar Gupta would be in conversation with Rakesh Jhunjhunwala, who we all know as this market guru, as ace investor. So do tune in to our YouTube channel for that.